Today, I'm excited to interview Saurabh Sinha. He's the co-founder and CEO of emids, which is based in Nashville, Tennessee. Early on in my career, I actually had the opportunity to work for Saurabh, and there I learned a lot and was really influenced by the impact he's making in the world. Saurabh has a very interesting background where he actually came from India to the US to learn our healthcare system and build his company 100% focused on helping healthcare advance their technology forward. He helps payers, providers, and life science organizations build their software and go to market to help interoperability across the whole healthcare continuum. Saurabh is a very interesting guy, and I really enjoyed interviewing him as well as working for him. I hope you enjoy the show with Saurabh. Hey, Saurabh, how are you?
Hi, Rebecca. I'm doing fine. How are you?
I'm great. It's so good to see you.
Yes, very good to see you. Hope New Jersey is treating you well.
It's been great. And you're very well repping your brand right there. Love the backdrop, love the shirt.
The first time I'm using it, so I'm glad.
Yeah, it looks great. Well, thanks for joining the show today. I'm really excited to have you. I gave a little bit of background about you on the opening here, but wanted to talk now and hear specifically from you what that journey was like coming from India to United States and not only building a tech company, but a healthcare tech company focused on the US healthcare system. Give us a little idea of the thought process through that and the experience.
Yeah, happy to. And, the first thing I'll say is that it never pans out the way you imagine, right? You sort of takes steps, you do building blocks, and then you see what you build. That's very much the story for us here, right? I came to US, to the Bay Area in California as a software programmer, and really loved software programming and got to work with amazing colleagues who were high quality software engineers themselves. And as I went through that experience for a year and a half, I really felt that there was a gap in the market for a company that provided high quality software engineering services. I really felt there was a gap there. And we got this started to do that. There was a lot of technology churn that was going around that time in the late 90s. Java had just sort of was becoming big. And then later, PHP came, Cold Fusion, a lot of rapid application development stuff came. And so we worked on all these new technologies for our clients and could put products on the market, in a very fast, in a very tight and fast timeline. And that's what we were really good at the beginning.
And we were talking about it earlier about how healthcare is one of the most regulated and slow moving industries. So you add this change to a consumerism mindset and having to really be up on digital transformation and move it forward, it's shaking things up a lot. So with that, what are some of the digital transformation challenges your customers are experiencing, and how do you guys come alongside them to help solve those problems?
Yeah, great question, right? So I would say there were challenges pre-COVID.
Yeah.
And then COVID has been the biggest digital transformation accelerator ever.
I'd agree.
And I think, I think the genie's out of the bottle. I mean, some of these things are not going to go back. It almost feels that if I talk about the transformation challenges pre-COVID, it could be, I'm talking about years back, because right now you're seeing a lot of digital actually happen. That being said, maybe we can discuss a couple of things that will continue to exist, right? So clearly with post-COVID, we're going to see a very high desire from the consumer or the individual to engage virtually, digitally, and in manners that are seamless with their entity, whether it's the insurance company or the provider or the pharma or whoever, right? The clinic. There will be a very strong desire to do that. And I think everybody gets it, right? So they're all working towards it. But a couple of challenges, I think number one is just culture. I mean, it's a huge change for companies to think about their customers differently. That's the big change, right? I mean, this is the new front door, right, to healthcare. And so that's, so culture and change is hard for all these markets. they're all working on those changes, but I would say that's the number one thing. They're not able to make decisions fast enough. They get overwhelmed by the churn of technology, and it can be overwhelming. The stack. I always have this joke, right? The stack with which you start a development initiative and the stack with which you finish the development initiative are very different.
Yeah.
So this could be just 18 months, right? Just 18 months and it'll be different. Yeah. So I think a lot of organizations are overwhelmed by that. There's a lot of change, a lot of churn. There's a talent shortage, which is also very hard to overcome. And then when you find talent, you need the right culture to get them and keep them engaged. So it's a little bit of a double whammy with many of these organizations.
No, it's interesting to me that healthcare always takes so much disruption to actually make a change. But if you think about it, not only do customers want telemedicine and faster access to healthcare, but it makes their businesses more scalable. So why would they not also want it? And it didn't take till they didn't have a choice. They went and made those investments, and now their businesses can scale. It's pretty interesting to see. So another thing that I think you and I would agree needs to be disrupted is this idea that you have around digital inequality. Explain to us a little bit about how you define that and just your thoughts about how that can be impacted to make a change in the world.
The reason I feel this is an important topic is as we go through digital transformation, we have to take everybody along. And, I remind our customers, and I see some of them really put in the effort, that as you all make plans for digital transformation, have a plan for those who don't have the infrastructure to be a part of your transformation. So there've got to be initiatives, there've got to be alternatives, there've got to be channels by which they're addressed. And there are options. It's not that options are not there, but it has to be something that has to be considered.
When you guys are making impact in that too, I've seen you give away laptops and do what you can to establish that, because it's something as, a millennial, especially, I'll take that title there for a moment. We don't think about it. And the reality is there's a lot of people who are affected negatively by not having access to a mobile phone right away to get their telemedicine, and making sure that we're going beyond just solving a problem one way is going to help everyone instead of just a finite group. So.
Exactly. Yeah. I think that's the assumption you don't want to make. As if you're a leader in digital transformation, you will have digital inequity as a part of your plan to address it.
So I think the reason you've been able to make the impact, even though you may not see the magnitude of it, is because of the leadership that you've attracted, the partners you've brought into your business, and even the customers. I'm sure at times you've been selective about them, but I'm curious, when it comes to finding leaders, finding people to be on your board and who to really bring into your tight group to drive your business forward, how do you go about selecting those people, making sure they're in the right seat to do what you need to do to accomplish your goals?
Yeah. And something I've learned over time. So as I'm about to tell you, I have to also tell you that it's never an answer that I had from the word go. But first thing I look for is a mindset match. And, we are a growth-oriented company. We're a growth-oriented management team. So it's important to have a growth mindset.
And you guys do something really cool every year with your customers that I wanted to touch on too, or you actually get them all together to talk about these different successes and bounce ideas off each other. And you're even helping, I think, to an extent, interoperability within healthcare, because you're getting everybody in a room for 2 days. Will you tell us a little bit about the summit that you put on every year? And I want to hear even a little bit about how this year's went.
Yeah, it's a great thing we do. It's evolved over time as with everything else. The way it started, Rebecca, we attended conferences and summits like just everybody else does, and it's I guess a indication of what the industry is. Even the conferences were siloed, right?
Yeah.
You had a provider only conference, you had a payer only conference, you had a pharma only conference, and you're like, it didn't help us because we had to go to 3 conferences and spend that much money, and then we were like, okay, and then it really didn't. We couldn't get a dialogue done, right? Because a real dialogue requires all stakeholders to come together. And so that's where the thought was born, that can we create a conference that brings the different stakeholders together, right? In an intimate environment. So we didn't want it to be a very scaled conference because I think that makes it too impersonal. That's how the idea came. And we started it, and we just finished our 7th annual summit. And by the way, it's an industry summit, so it's not just for customers. Of course, a lot of our customers attend, and we give a lot of preference for them to attend. But we have leaders who are from organizations that are not our customers. We have leaders from regulatory bodies and others also who will attend. The thought, one was to get these people these leaders in an intimate environment. The other thing is to talk about the right things. So we work with them. We define topics. We create panels around topics, and really get them to share their experiences and what's going on in their world and what are their thoughts about keeping a more integrated ecosystem. So all in all, I think it was a great summit this year, and I'm sure next year, I'm really hopeful we'll all be back in person, etc. But I think a footprint of digital summit will stay for sure.
Oh yeah, because you can make just a broader impact. So I may know the answer to this question then because of what you just explained at the summit, but I'm curious if there's other ways that you go about staying current on technology trends and advancements beyond just what you're doing in the summit. Are there ways that you stay in mastermind groups amongst your peers, constantly just talking about what's next for healthcare? How do you go about that?
I want to do it. I think I do it at 2 speeds, let's say. Yeah, okay. One speed is the reading, talking to peers and talking to industry experts, ideating, right? So all that sort of is one speed, and I do that. It's fun, right? But the speed which I see a lot of value in, and both are required because one gives you raw data, one gives you structure, right? So the reading, the talking gives you structure. The one that gives you raw data is being with practitioners.
Okay.
I make it a point to spend time with practitioners. So, and these are typically the leaders in the company who are accountable and responsible to implement technology initiatives, make it work, to actually deliver an outcome using technology, right? Those are practitioners, and they're it's amazing to spend time with them because they're the ones who will quickly separate the real from the BS and say, no, this is what really works and stuff, right? So I do both the speeds. Like I said, practitioners is really a lot of fun because you learn of the real experiences. And then the reading and other stuff is good because it gives you a little bit more language and structure. And when you sort of get it together, you know where things are. And the practitioner thing grounds you. But the other speed of reading and visioning keeps you motivated about tomorrow and what else might come, right, eventually. So you want to do both.
Yeah. That totally comes back to where you started our conversation at, and the fact that back when you decided to become a healthcare-focused software development company, you felt that it was very much important to understand the industry and understand their problems. So the fact that you still practice that by spending the time on the front lines with these folks who are making this real impact, I think is why you've continued to be successful and only advanced your understanding and impact across all of healthcare.
Yeah, I think it's important to do that. I feel, and Rebecca, you're in this space as well. I'm sure you agree with me. We learn a lot when we spend time with customers.
So that comes to my final question, Saurabh, and that is, what is the core principle you live by to be successful in business?
That's an interesting one. I've always had a very high hunger for learning. And I think as long as there's learning, I seem to have endless motivation to keep doing whatever I'm doing. I think the most exhilarating times are when I feel I've learned something phenomenal, or I've connected the dots, but it's taken me a year to figure out all the dots and connect them.
How do you find that you learn the best? Is it by being hands-on? Is it consuming content? How have you just found that something that sticks with you and you're able to action really fast actually gets in?
Yeah, I think it's all of the above. Learning is multidimensional. I feel, and I've just learned that also, that how to learn better, right, over time. But it is multidimensional. Being hands-on helps a lot. Makes you a little sharper. A lot of people think of being hands-on or as being into the weeds, but I think a lot of people don't realize that to go through clutter, because there's a lot of clutter out there. Hands-on actually helps because you know what to cut through and what not to, right?
I appreciate you sharing.
Yeah, that's good. Good conversation.
Well, thanks for being on the show, Saurabh. I hope to see you in Nashville again soon.
I hope to see you too, and I'm very proud of you that you're doing this.
Thank you.
This, video cast. I think it takes it takes some courage to put yourself out there and do this. So very good luck. I don't know if everybody knows how good a drummer you are. I've seen you play. I actually still have the recording.
That's the alter ego.
No, you're an amazing drummer.
Thank you.
I was amazed because it was one of the summit pre-evenings, right? Which I don't remember which year, but it was the reception, and you got on the stage and did the drums. I think all of us were like, "Wow, that is some talent." So yeah, you should pursue your own learning and talents your own way.
Yeah, why not? Oh yeah, I won the drum competition for what it's worth.
Oh yeah, I told that to the other gentleman that you were hands down.
Yeah, that was a fun one. Oh, good times. We had a lot of fun. I look forward to the summit next year, and I know you guys are starting to launch more and more content, so I'll make sure to share those links in the YouTube video here. And really enjoyed having you on the show. This was a great.
Oh, thanks for having me. Appreciate it. Good luck. All right.
Thanks, Saurabh.